As promised, our guest tonight is Dr. Patrick Hagen. There you see Doc, and great to have you. I finally got you in the one-on-one chair.
Yes, sir. It's been years, and honestly, I don't feel worthy to be here because I see the wonderful people that achieve a lot and accomplish a lot in our community over the years. So I've always felt like I wasn't worthy or didn't belong, but this time I'll give it a shot.
Well, trust me, you are worthy. I want to start off because I can go back into the history of the Hagen family.
Sure.
And I never forget. First Hagen I ever met was your dad.
Yes, sir.
And we would go get treated by Dr. Hagen, who would always give us the famous Hagen sinus wash.
Right.
Or whatever y'all call it.
Yes.
Okay, the sinus wash. So that was indicative. When you walked in that office, you knew Dr. Hagen was giving you the sinus wash. And although as kids, we probably didn't really want to go through it, when you got out, you felt much better.
Yes, sir. Yes, sir. In fact, Dad always said, if you wash people's sinuses, give them a little injection, and they feel better than when they're walking out the office, as opposed to writing them hundreds of dollars worth of prescriptions and say, go take this, you'll feel better in a few days. That's what we always focused on. But you know, my father was just a wonderful man. I mean, like many kids, to me, he was my hero. Right. And he grew up in New Orleans, and he went to Jesuit High School. He went to Tulane for a year as an engineer. And then at the end of the year, the dean at Tulane approached him and said, Mr. Hagen, I don't really think you're cut out to be an engineer. And I said, well, Dad, that sounds like you got kicked out of school or something. And so then my dad went and worked for a year as a longshoreman at the age of 17, 18 years old on the riverfront in New Orleans. Then after a year of that, he decided he didn't want to do that for the rest of his life. So he got a job at Baptist Hospital as a scrub nurse, went to Loyola University, worked himself through pre-med, and went to medical school. Then after medical school, he went and became a naval flight surgeon in Pensacola. And then around that time, in the mid-50s, he did eye, ear, nose, and throat. Right. And then when he got out, he decided to locate in Houma to focus on ear, nose, and throat, while Dr. Ellender, who took him in on Dunn Street, focused on eye.